So HPV and cervical cancer are closely related, but they're not the same thing. HPV stands for human papilloma virus, and it's a very common virus, and it's a virus that, if persistent in our bodies, can lead to cervical cancer. Cervical cancer is cancer of the cervix, and the cervix is the opening of the womb. So the risk factors for cervical cancer are: 1, having a cervix, so that applies to women and other people who have a cervix, which is the opening to the womb. The other risk factor is sexual activity. That's any type of sexual activity at any point in your life. And as well, cigarette smoking is also a risk factor, but the biggest ones really are having a cervix and exposure to HPV. So in Ontario, in spring of 2025, a change was made that screening went from being done by a Pap test to an HPV test. The procedure is exactly the same for both the patient and for the provider, but with a Pap test, we're looking for abnormal cells of the cervix. With an HPV test, we're looking for the presence of HPV. So it's actually more upstream than actually looking for those abnormal cells, so it makes it a more accurate test and means that we can do it less often. So HPV self-collection tests are available in some parts of the world, in Australia, and even here in Canada, they're available in BC. Exciting news for those of us who live in Ontario is that self-collection is coming. It's being piloted right now at a few sites across the province, with Women's College Hospital Family Practice being one of them. So if people want to be tested or screened for cervical cancer, and screening means catching something before there are any symptoms or while the person is still feeling well, the best way to do that is to see a family physician or a nurse practitioner and to have a cervical screening test. There are 2 ways to do that. One is through a speculum exam, which is what most people have to do, and a new exciting emerging test is HPV self-collection.